If you're looking for a practical comprehensive tutorial for the CCS part of the Step 3 exam, this is the video for you. Because today I will give you a detailed overview of the CCS cases of the Step 3 exam, go over common diagnostic tests and orders, and finally take you step by step to show you how to actually solve a case. Before we get started, if you're interested in seeing more CCS cases, more practical examples on how to solve CCS cases, make sure to check out the Match Guy CCS course that I'll leave the link for that in the description below. Also, I know that biostatistics and the abstracts are a challenging part of the Step 3 exam, and that's why we made a detailed course on how to ace the biostatistics and the abstracts of all USMLE exams. And by the way, I will also give you a special discount if you're interested in buying UWorld, which I will be using their platform to demonstrate the CCS case. Now let's start with what are the CCS cases. They are computer-based case simulations. So it's like you're presented with a patient in real life. They give you history, vital signs, you do a physical exam, electronically of course. Then they take you through the case, they ask you what do you need to order, they give you prompts based on your orders, and the case goes back and forth based on the different sets of orders you placed. That's why many students find the CCS cases to be the challenging part of the Step 3 exam, because they're different than what they're used to in Step 1 and Step 2 CK with the MCQ questions. However, hopefully with this video, and if you're interested in getting my CCS course, we will make this part ridiculously simple and easy to understand. CCS cases could be 10 minutes or 20 minutes. If the case is 10 minutes, you'd have 8 minutes to solve the case and 2 minutes to place the last orders. If the case is 20 minutes, you would have 18 minutes to solve the case and 2 minutes for the last set of orders. So how to approach CCS cases? As I said at the end of this video, I will go through an actual CCS case and show you how it's solved. But now I will go over some general things that can apply to most CCS cases. When you start the CCS case, the first thing that you have to answer is, do I need to place a set of emergency orders before I proceed to the physical exam, or I can start with the physical exam directly? Because sometimes you're presented with an emergency case like tension pneumothorax, and in this case you need to do some things before you go and do your physical exam. What are common emergency orders? Pulse oximetry, cardiac monitor, blood pressure monitor, IV access, normal saline, oxygen, and EKG. But remember, each case is different and you might add certain emergency orders or remove some based on the case. So now if the case needs emergency orders, you place them and go to the physical exam. If the case does not need emergency orders, you go directly to the physical exam. Now when you go to the physical exam, you need to decide, do I need to do a full physical exam or a focused physical exam? A full physical exam is generally done in the outpatient setting, or if the patient is not suffering from severe pain, so you can go and do a full physical exam to make sure you don't miss anything. But if the patient is in severe distress or there is something acute happening, it doesn't make sense to go and do physical exam of everything, including the parts that are not related to the case presentation, and delay the management of this acute condition. So in these acute conditions, when the patient is in severe distress, go and do a focused exam, focusing on the systems that are related to the presentation, and then later on you can go and do a full physical exam. After you do your physical exam, you start ordering diagnostics like labs or imaging or other diagnostic modalities. So that's why from the first case presentation, from the vital signs, the patient history and physical exam, you need to start thinking of your differential, which will dictate your orders. Now let's go over some common diagnostic tests. CBC is one, BMP, liver function test, TSH, ESR and CRP, 12-lead EKG, ABG, PT-INR, urine analysis, urine toxicology screen, fecal occult blood test, blood cultures, CSF analysis, synovial fluid analysis, sputum analysis. So as you can see, these will change based on the case. Common imaging modalities include X-rays, CT scans, ultrasound, MRI, and echocardiography. Another important part of the CCS cases is symptom management. So if the patient is having pain, you don't just let them suffer. Common medications you can use for pain management include morphine, NSAIDs, Tylenol, hydromorphone, oxycodone. For nausea, you can give Zofran or Phenergan. For diarrhea, you can give loperamide. And for cramping, you can give dicyclomine. Monitoring is another very important part of the CCS cases, because if you're managing a case conservatively or after an operation, you need to make sure that the patient stays in good condition until the case closes. So what are different ways of monitoring a patient? And again, this will depend on the case. CBC, ESR, oxygen, blood pressure, vital signs, BMP, physical exam, and interval history. Because even if you do your initial physical exam at the beginning of the case, you can still get multiple physical exams, let's say 2 times a day or 3 times a day based on the severity of the case. If you think surgery is the treatment for this case, you can order a surgery consult. Then you can prepare the patient for the surgery by making them MPO, giving them IV fluids, making sure they have IV access, getting PT and PTT, ordering EKG if needed, ordering cefazolin, type and cross match, and then you can order the type of surgery in your orders. So that was a quick overview of the step 3 cases, and now let's dive into solving an actual case. So we'll start with this case. Whenever you start a case, you'll have the case introduction, which gives you a brief summary of what the case will be about. Here we have a 34-year-old female brought to the ED after a motor vehicle accident, complaints of abdominal pain. So now you should start thinking of the different differentials that can cause abdominal pain. The patient is in acute distress, that's very important to know, and grousing with her hands placed over the left upper quadrant, or left upper abdomen. So now you know abdominal pain, left upper abdomen, and distress. So that will change the order in which you do things. Are you going to be doing emergency orders and then physical exam and then other orders, versus just a regular outpatient encounter where you do a physical exam and then you order the tests? So that's the importance of the case introduction, and also knowing the location of this case, which is the emergency department. So you click OK, you get presented with the vital signs. That's also very important to know, because that will affect the urgency in which you do things, and whether you do emergency orders before physical exam or like other sets of labs and imaging. So we can see that the temperature is normal, the patient is not in fever, slightly rapid heartbeats, 100 beats per minute. The important thing to know is the blood pressure. The systolic and diastolic. Is the patient hypertensive, hypotensive, or normotensive? In this case, the patient is normotensive. Sometimes if the patient is extremely hypotensive, that will change significantly the order in which you do certain things. So here you have height, weight, and BMI. We click OK, and then we get presented with the full history: abdominal pain following a motor vehicle accident, history of the presenting illness, previously healthy 34-year-old female brought to the ED by paramedics after being involved in a high-speed car accident 30 minutes prior to arrival. She never lost consciousness. However, she has been complaining of severe left upper quadrant abdominal pain, which she rates as 9 out of 10 in severity. That's very important for us to know, to start thinking of what could be causing this and what would the next steps be. She has felt nauseated but has not vomited. Her last meal was 3 hours ago. That's very important for planning surgery. She denies any previous medical problems. She was enrolled in a drug rehabilitation program in the past. She drinks alcohol every evening. That's important for counseling. If the patient is drinking alcohol heavily, we counsel them about alcohol at the end of the case, after we manage all the important things first. Her last menstrual period was 4 weeks ago. That's also very important for female patients to order pregnancy tests versus not. She's reluctant to give further history secondary to the severity of her pain. All other histories are unobtainable at this time. And now after you click OK, you're gonna go and start either ordering orders, imaging, labs, or you do your physical exam. Since the patient is in distress, this is a car accident, a trauma case, the patient is in distress, we need to start ordering some emergency orders before we do our physical exam. To write orders, you go here, write orders or review chart. You're under the order sheet and you click order. Since the patient was involved in a car accident, we're gonna order cervical spine immobilization, or sometimes it helps you to continue the word, so I'm gonna pick immobilizer. You can put all the orders in the same box and then you can start confirming them to save time. We're also gonna order pulse oximetry, blood pressure monitor, cardiac monitor, IV access, normal saline, and oxygen. And then we're gonna start confirming orders. So I'm gonna click confirm orders. Cervical spine immobilization, and that's to stabilize the spine, since this is a trauma case. After we get CT scans, we can remove the cervical spine immobilizer. So confirm orders, the pulse oximetry. You're gonna order this stat. In the exam platform, it doesn't ask you for routine or stat, but stat means you need it now. Routine is less urgent, but since this is an emergency case, it's in the ED, we're gonna order things stat. Frequency, if you're gonna order things multiple times, and that's important for monitoring a patient, and we'll do that after the first few steps. But for now, we're just gonna either keep it empty if we want 0 frequency, or we click 0. Blood pressure monitor continuous, cardiac monitor, IV access, and normal saline, intravenous, and oxygen, confirm inhalation. And as you can see here, all the orders are time stamped at day 1, 9 a.m. and this is the time that the case started. So you'll see a difference between the simulated time, which is the one down here, and the real time, which is how much time you actually spend on the case. So if you spent 2-3 minutes putting these orders in real time, the elapsed time here will be 3 minutes. However, this might all be time 0 because you have not advanced the clock yet. So the two are not necessarily correlated, but just keep in mind that when you order these, even if you order the pulse oximetry after the immobilization of the neck, they will all be time stamped at the same time, even though in real time you ordered one after the other. And the CCS cases are either 20 minutes or 10 minutes of a real time. But simulated time, it might be a day, it might be a week, it might be weeks if you're advancing the clock a week or 2 or 3. So just keep that in mind when you're doing the different orders. It doesn't matter which order you put the orders in if they're put all at the same time. So after I put all my orders, I'm gonna go and do my physical exam, and to do that you go here. And generally for emergency cases, we don't do a full physical exam. Why? Because you wanna do a focused exam on the parts that the patient is complaining about, and later on we do a full physical exam. However, trauma cases are different. Why? Because we want to do a full physical exam when we're assessing the trauma to see if there are other things that we don't want to miss. So we order appropriate scans or appropriate labs to rule out certain problems. So again, in emergency cases, you do a focused exam, so only the parts that matter, and then later on you do a full physical exam. But in this case, since it's trauma case, we're gonna order all the sections of the physical exam and click OK. And that's gonna tell you the time it's gonna take to perform this physical exam in simulated time, not in real time. It's gonna take 15 minutes. And now you can see why it's important to do a focused exam in certain cases, because if the patient is suffering and they're in severe pain, you don't want to be spending 15 minutes doing possibly irrelevant exams where you can be doing something else in simulated time. But in this case, since it's trauma, we're going to do a full physical exam and click OK. And then you're going to start getting the results of some of the orders you placed. For example, the oxygen saturation here is 99%, and it's going to ask you to continue the clock or not. And why is that important? Because if you get a result that will change what you will do. Let's say you had a very, very low oxygen saturation and you have not started oxygen, you click stop now and you start oxygen. But if what the result is expected, or you've already done something to address that, you click continue. Now we're getting a notification about the blood pressure cuff. We're gonna click OK, continue. The cardiac monitor, continue, and we're getting the results of the full physical exam. In the real exam, you won't have time to read the full physical exam word by word, so you have to focus on the main things that you worry about, and in our case it's the abdomen. You can screen the rest quickly to make sure you don't miss something abnormal in the other sections. So in the abdomen it says soft and non-distended. That's very important to rule out acute peritonitis, which requires urgent surgery. A steering wheel shaped contusion is noted on the left upper quadrant, and you have to start thinking of what resides there and what could be affected. There is no flank swelling or bruising. Patient has severe abdominal tenderness over the left upper quadrant. There is no rigidity or guarding. That's also signs of acute peritonitis, and if changes the management of what you're gonna do. No hernias identified. Rectal is important in trauma cases to assess spinal cord injury. It says here sphincter tone normal. And as I said, you can screen the rest of the sections very quickly just to make sure you're not missing a fracture or something in the chest, you can't hear lung sounds, that would also affect management significantly. And now we're gonna click OK. And now after we placed our emergency orders, after we did our full physical exam, the patient is stable, we're starting to think of differential, which is spleen injury in this case. We're gonna start putting our orders to diagnose this and manage it. We're gonna go to orders, we're gonna order blood type and cross match, which is important in trauma cases, CBC and BMP, which I usually order in most cases. Since this is trauma, we'll also order LFTs, amylase and lipase. We're gonna order urine analysis, ABGs, EKG, PT, INR, PTT. Also important in trauma cases, blood, alcohol, urine, toxicology, HCG, spine x-rays or CT, chest x-ray or CT chest, CT abdomen, very important since we are having pain in the left upper quadrant. We're gonna make the patient MPO since we're suspecting something that might require surgery, and we're gonna give few medications to help with the patient pain and nausea. Since the patient is in pain, we're gonna order morphine or hydromorphone, and since the patient is nauseous, we're gonna order Zofran. And we're gonna start confirming the orders, blood type and cross match, stat, CB with differential, BMP, LFTs, amylase serum, lipase serum, urine analysis, ABGs or arterial blood gases, EKG, 12 lead, PTINR, PTT, blood alcohol, urine toxicology. We're gonna order the beta ECG in urine, the cervical spine x-rays. In practical life, you generally order CT scans to rule out spine injury in trauma cases. And the same for the chest CT, chest x-ray, we generally order CT, chest, abdomen, pelvis in trauma cases where you're suspecting injury. So here, but we're gonna order chest x-ray and CT abdomen, MPO. We're gonna order morphine, IV, and Zofran IV as well. And now we put all our orders, and you can see they're timed after 15 minutes from the first order because it took 15 minutes to do the exam, but time-wise we spent more than 0 minutes putting all these orders. So now that we put all these orders, we want to start advancing the clock to see what the results are. So we're gonna go to the clock here, and there are multiple options. You can click on certain day or in certain hours, because here you can see the report time, but I think the easiest way is just to click with the next available results and click OK. HCG is negative, the patient is not pregnant. We can go again with the next available result. Another option is to go to in and let's say put 2 hours, and this will keep advancing the clock up to 2 hours. But with each result, it will generally ask you to continue or stop. So if you see something that requires you to change management, you click stop. So we're gonna click OK, and we got the results of the EKG, just sinus tachy at this point, click OK. You see here, stop now or continue, or click continue. We got the results of the ABGs, it's generally normal, continue. We got the results of the X-ray, no abnormal findings. Okay, continue. We got the results of the CBC. Important things to keep in mind is the hemoglobin. Since we have abdominal injury, it's on the lower side, but it's not within normal limit. A white cell count is also within acceptable range, and platelet count is the same. And here is the differential. That's very important for infection cases to see the white count differential. We're gonna click OK and continue. Here is the BMP, generally normal. OK, continue. The urine analysis test, generally negative. OK, continue. The PT, normal, continue. The alcohol level, 0, continue. The cervical spine, no abnormal findings. OK. Here you can stop now and remove the cervical immobilizer, or you can continue and remove it in a few minutes. We'll click continue. Now we got the CT results. That's technically the most important part of this case. And the impression is subcapsular splenic hematoma. You can read the details of the CT scan, but the main finding is there is a splenic hematoma. So here you have to click OK and stop now. Why? We don't want to advance the clock more. We want to get a surgical consult since there is a splenic hematoma. So we're going to go to order and we're going to type surgery consult and we're going to click confirm order. We want general surgery consult, confirm order, stat, OK. And we're going to write the reason splenic hematoma and click OK. We're going to go here as well to cancel the neck immobilizer since the neck x-rays were negative. And we're also going to transfer the patient either to the floor or to the ICU. Since the patient has splenic hematoma, since they're in distress, it's not unreasonable to transfer them to the ICU. So we're going to change the location here and click change location. And it's asking you to confirm the move with these orders. We're going to click confirm move. We got another set of vital signs. You can see the heart rate is still high, but the patient blood pressure is still normotensive. We'll click OK. Now the patient is in the ICU. And I'm gonna go again, click maybe in 1 hour to see the results of the other tests we ordered and the result of the surgery consult. We'll click OK. Here we got the results of the surgery consult. The consultant has no explicit management recommendation at this time. Please order any additional test therapies or procedures if needed. That means at this point, the surgery team does not want to take the patient to the OR or do anything different. So you just continue your medical management of this case. So we're going to click continue, continue here. We got the cross match result, continue. We got the amylase result, continue. We got the PTT, okay, continue. We got a patient update. The patient reports her pain is decreasing. She described its intensity as 6-7 on a 10-point scale. So now the patient is starting to improve. You can see simulated time-wise, we're at 10:30. So only an hour and a half after the case started, which is, it was day 19 if you realize when the case started. So in a few minutes after we get a few more results, we can start ordering the interval history and the interval physical exam. We're gonna click OK, continue, and we're not getting more results. So I'm gonna get an interval history here, interval follow-up, and the main things that I want to check maybe is abdomen, very important, chest, and general appearance. So every few hours in your case, simulated time-wise, you go get an interval history, physical exam, set of maybe like the main vital signs, blood pressure, heart rate, because these are very important to assess how the patient is improving, not improving, worsening, because that will also change your management. So I'm going to click OK. OK. Patient pain is less severe. It's 6/7 on a 10-point scale as we just learned. The abdomen. Now the patient has mild abdominal tenderness over the left upper quadrant. The first time we checked this, it was severe. There is still no rigidity or guarding, which is important to rule out acute peritonitis. The chest exam and the general appearance is good. So always keep in mind the monitoring part of the case, because you will get points deducted if you don't monitor the case through interval history, interval physical exam, and sometimes labs. So for example, in our case, it's important to monitor the hemoglobin. So I'm going to order H&H. I'm going to order another set of blood pressure and maybe cardiac monitor check. Click confirm orders, H&H, confirm, we get stat. Here you can start ordering frequency. You can order every 6 hours, for example. Click OK. Blood pressure continuous, stat. And we're gonna order cardiac monitor check, confirm, stat. We're gonna go here and advance the clock maybe 4 hours or 6 hours. And we'll get the results of these things that we just ordered. And you can do the same. You do the same monitoring every 6 hours. And if the patient improves after, now it's telling us the case will end in 2 minutes real time. On the next screen, you have to finalize the care of this patient or the current condition by deleting orders you don't want to continue anymore, adding orders that needs to be done, adding orders that are relevant to the patient current condition to be done in the future. So in this screen, you won't get a response back. You won't be able to advance the clock, but you just kind of put everything you missed, everything you need to add at this point. And that doesn't mean you necessarily did something wrong or you missed something, but sometimes even if the patient did not approve, sometimes the case ends and they want to see what are the kind of last things that you're gonna add. So I'm gonna click OK, write new orders. This is also the place where you put counseling. So we're gonna order vital signs every few hours. We're gonna order H&H every few hours. We're gonna order blood pressure as well, which could be included as actually in the vital signs. We're gonna order counseling. You'll get a long list of things to counsel about. So I would recommend you be more specific when you order that. And we can also order alcohol education since this patient uses alcohol. And this is actually the place that you usually put your counseling and education at the end of the case, and click confirm orders. You get vital signs. We'll order it, for example, every 6 hours. Okay, we'll order H&H maybe every 6 hours as well. And you see a long list of counseling. So if patient needs safe sex counseling, you can tell them about that. If you want to counsel the patient in general about their disease, relaxation technique, rest home. So familiarize yourself with the different types of counseling available, so you can, when you get these, you pick one quickly. Click confirm order. We'll do that routine. Okay. Alcohol education, confirm orders. And the 2 minutes ended. I hope you found this video helpful in your preparation for the CCS cases of the Step 3 exam. If you need to see more examples, go ahead and check out my CCS course, which is risk-free, because if you're not satisfied, we'll give you your money back, no questions asked. And by the way, you can combine this course along with my biostatistics and abstract courses, so you can get them all in one package, all risk-free. And I'll leave the link for all these courses in the description below. Again, if you found any value in this video, I would really appreciate it if you hit the like button, subscribe to the channel, and share this video with your colleagues who is also preparing for the Step 3 exam, because they might benefit from it. And now if you want to take advantage of the discount I have for you for the UWorld question bank of the Step 3 exam, go ahead and check in the description below how you can get that discount. Thank you everyone so much for watching, and good luck on your exam.